Just a little bit mental health conditions in a child. The cause of it remains largely unknown. Now, most parents dislike the word mental health conditions in their children. They prefer you to say the child has a behavioral problems. They prefer you to say that there's an emotional illness in the child that will go away. They do not like the word mental health or mental problems. They prefer you to send their child to a psychologist as opposed to a psychiatrist, because there is this stigma that psychiatrist, it means, bad news. So let us look back again. The causes of mental illness in a child remains largely unknown. Again, there's no blood tests, no CT scan, or no sort of investigations that can be used to find the cause for mental illness. Now, there are conditions, abnormal chromosomes, inherited conditions, where obviously you look at most of these children and they do look a little bit abnormal when they are in school or among a group of children. They got abnormal faces, they got abnormal stands. There's some physical abnormality in most of them, but not all. That will warn that there is a little bit abnormality of the activities of the brain. But again, you do have totally normal children that can have mental health condition. And again, there's no blood test that we can do to find the cause. Again, the cause in most of them are unknown. So what we do again is to treat the symptoms, is to treat the behavior of the child, and to give psychotherapy and or medication to try to work together to see if we can get some control and make the child fit into society. Before we could proceed to describe abnormal behavior in a child, we have, when looking at mental health conditions in children, before we could proceed to describe what is abnormal in a child's behavior, we have to first identify which is the normal. In this area, what is normal to a child, we have to look specifically at cultural factors. Cultural factors will dictate what deviations are acceptable in that child's culture. Like if it is normal, the child culture for the adults, the children to cry, if they are emotionally upset, if the child cries easily, and in the child's head, that is considered normal in that particular culture. Physical problems and mental health problems are usually viewed separately, but again, as I said before, they could occur together, that the child may have obvious physical abnormalities and can also have associated mental health problems. Mental health, again, as I said, is sometimes viewed with shame and embarrassment by the family members, and they prefer the word emotional problem or emotional illness used as opposed to straightforward psychiatric problems. Other biological factors that are found or play into the presence of mental illness is usually associated with inherited or congenital or genetic conditions, where obviously the child will look physically strange or abnormal, does not fit into the normal background, and then it is accompanied by behavioral problems, which again reflect some sort of mental disability. And again, back to it again, as I said, to treat these conditions, in most of them, we do not know the cause. For example, just as an example, if you have a sore throat and you have a strep throat, we know that there's a specific bug in the throat that causes strep throat, so we can get in there and give you antibiotics to kill that bug and get you better. But in a lot of the mental health problems or behavioral problems, we do not know the cause of most of them. And therefore, what we do is to treat the signs and symptoms to make the patient fit as normally as possible into the family and into the society.